HPV is an epidemic, and we have facts you don't know, but you need to. We have information that will not only shock you, but will hopefully change your life and the habits in the bedroom. I'd like to welcome Dr. Nicole Nguyen to the show. Not all, and by the way, welcome.
Hi, Taylor. Nice
There are surprising details about the HPV virus that the general population does not know about. Let's talk about that. Let's talk about the percentage, by the way, of people who have HPV and the percentage of people that have been exposed to it at some point in their life, they don't even know it.
Right. I mean, HPV is the most common sexually transmitted virus. I mean, it's amazing how much it's out there and people don't even know about it. So about 80% of the population at some point in their lives is expected to be exposed to HPV. Now, you can clear the viral infection, but sometimes it can persist in your body as well.
And is the type that stays in your body, that's the type that actually will create cancer cells, right? Or that we know that cervical cancer is usually caused by HPV exposure. There's
correct. There's a lot of cancers that are caused by HPV. Rectal cancer, probably the #1 cause is HPV. People don't realize that. Farrah Fawcett majors, anal sex, that's where you get it.
Really?
Yes. Yeah.
So a lot of people don't realize that. And throat cancer too.
Throat cancer,
so that would
mouth and throat cancer.
Is that oral sex as well?
Correct.
So when Michael Douglas came out and said, you know, he had HPV exposure and his throat cancer was caused by it, and a lot of throat cancers are, people automatically assumed he was gay, that he was with another man from oral sex.
Right.
But no, it doesn't matter. It's oral sex is oral sex. So you could have oral sex with a woman and get it.
Correct.
Because from what I understand, condoms don't even stop this disease because it could just be...
Right, it's not 100% protection. So condoms are the best way to help protect yourself besides getting the vaccines, but it's not 100%.
But not only that, because all you have to do is rub up against somebody and get it.
That's true.
And if you have oral sex, you're going to get it. You can't get it.
Right.
And with a lot of people being carriers, people, mostly men, you said men are the, what did you call them?
Men are the vectors.
The vectors. Men are the vectors because they carry HPV.
Most of them
and
don't know they have it.
And they don't even know it.
Correct.
And the problem with HPV, not only can you get the genital warts, that's a low risk HPV, right?
Right.
The high risk is it causes cancer. It causes cancer. This is a big deal. People don't realize this causes cancer. For the percentage of cervical cancers that are out there, how many of those cases were caused by HPV exposure?
Well, it's estimated at least 99%.
99%?
It's rare to see a cervical cancer in a patient who's not sexually active or has never been.
And there is no cure. And here's the thing. These women didn't even know they were exposed.
Correct.
Because there's no symptoms. There's at least 140 strains?
150 or more estimated.
150 strains. And how many of those strains are the high-risk cancer-causing strains?
I don't know if there's an exact number, but there's a large number that are high risk and then the rest are low risk. I would say primarily they're low risk, but there are the high-risk types, probably about 30 or more.
This is news you can use. This is news that will protect yourself, protect your children, protect your friends, your loved ones, because they don't get it. Having sex, sexual relations, unless you're with in your monogamous relationship, and even then, there's no guarantees because
they could with anybody else.
If they've had sex before, they could still be a vector, still carrying a live virus.
Yes. A
live virus. The only way to know for sure is get tested, make sure you're not carrying a live virus, because you can be exposed and your body, you have a live virus and your body can fight that virus, correct?
Yes.
And can the virus be now, does a scenario like this happen where you can fight the virus? Because you can show that you've at least been exposed to it, right? Because you have the antibodies. But can it still cause cancer even if your body fought the virus off?
Well, occasionally it may disappear, what we think disappears because it's not showing up on testing, but it still could be persistent in some cells in your body and not be showing up on testing. And the testing is variable too. You can't really, there's no real good test for men, so you can't really test men. And women, usually they check the cervix to see if there's infection in the cervix. That's the best way to check. So that's
only by getting culture to just check the cells.
Correct.
Now, throat cancer. What percentage of throat cancers are caused by HPV exposure?
Probably 60% or more.
And then the rest are probably caused by
Smoking.
tobacco and chewing tobacco, everything else, right?
Correct.
Smoking.
Yeah.
This is shocking information. The media doesn't talk about it enough. There's no public service announcement. People just don't get it.
Yeah.
There are young people today that they think having oral sex is safe sex, and it is not. You can die from oral sex.
That is true.
You can die.
You can get a lot of things from oral sex, including HIV.
Yep.
So it's not safe.
Abstinence.
But
Keep
that's
in
no
touch
fun.
with yourself. I don't know. I don't know what to say. But, you know, I mean, or when you decide to have a monogamous relationship, and again, only you can guarantee that that you're monogamous. There's no guarantee your partner is.
That's
it's all
true.
faith.
That's true.
But I suggest have that person tested, right?
Yes, I would agree. That would be good. But again, you can't test men.
What do you mean
So
you can't test
There's
men?
not really any good tests for men, unfortunately.
They could be
And
a
serum
vector.
test, you know, you
Excuse
can't
me.
do serum.
Excuse
Right.
me. They're the vectors, right?
Yes.
They're the ones spreading this, but there's no test to see if they have either been exposed or have a live virus?
Right, because the swabs are unreliable.
I didn't know this.
Yes, and if you do a serum test, that's unreliable too, because they could have formed antibodies against it, but they might not have the virus anymore. So that doesn't mean they have the virus. And again, if you test 80% of people are going to show up positive, but that doesn't mean they have the active virus in their body.
So 80%, well, okay. Another great reason to be a woman. Can't we get a break around here? Just a little break? Jeez. Oh my gosh. So we got over 150 different strains of HPV. We still don't know how many of those strains are high-risk cancer-causing strains. The low risk can cause those beautiful things called genital warts. Hopefully you haven't had them, but if you have, that's better than getting the high risk with no symptoms, right?
Right.
Because I guess you can, where do those show up? Like on the outside, inside?
Yeah, usually they show up on the outside. They can show up on the inside of the vagina as well, and on the cervix too.
And,
But usually they're on the outside, and also on the penis. They'll show up on the penis.
So that's the only reason, that's the only way a man would know, but even
Right.
then that's low risk.
Yes.
Can they be contagious men for low risk before they have the genital warts?
Yes. Yeah,
Is
they
it
can have
like
the
the
virus,
herpes virus
just like
that
they
it
have
is-
the high-risk virus too.
So like the herpes virus, from what I understand, your skin starts shedding cells before you have the sore. That's when you're still very contagious.
Right,
And people think
right.
they're only contagious if they have a sore, but they're actually.
Yeah, and a lot of people with HPV virus, even the low risk, don't ever develop genital warts, but they still have the virus. So.
Can they fight off the virus with a strong immune system?
Yes. So the best way to fight off the virus is to keep your immune system healthy. I tell my patients.
Okay, wait. We're gonna figure out how not only you get tested, because if 80% of the population has been exposed or hasn't, you might be one of them. And so we're gonna give you tips on how to at least get it to where you can fight it. You know, you can't stop exposure, but at least you can fight it so it's not live, so you lessen the chance of getting cancer. We're gonna talk about that when we come back. We'll be right back.